let's start the ball rolling with swelling-related, pregnancy swelling-related conditions and their treatment.
Okay, so I mean, let's just talk a little bit about why we get swelling when we're pregnant, I suppose. Perhaps a subject I'll never be an expert on as a man, but from a physiological from a physiological perspective, you have to look at why women get swelling. At the proper term for it, if you like, is edema, which edema just describes excess fluid in the tissues. And it's a physiological reaction to being pregnant. So it's a normal and natural thing that happens, actually. There's a number of reasons why it happens. Hormones have an effect. That's one of the reasons. And the body's trying to create a state where the body can accommodate the growing child in the womb, the growing baby. And then secondly, you do have changes in specifically in the venous flow and the lymphatic flow. And the lymphatic flow is basically, lymphatics are our drainage system. So the lymphatics remove all the excess fluids from the extremities of our body, from our legs and arms, move them back to our central core of the body to be reintegrated back into the vascular system, into the blood, really. And what happens is during the pregnancy, with these changes in posture and the space occupying effect of the baby, is that this lymphatic system is compromised slightly. So it's not as effective, and it's more difficult for the body, for the drainage system to work and the fluids to move back to the center of the body, basically. So that's generally why edema happens during pregnancy. Yeah, so if we look at it from an osteopathic perspective, what we're trying to do is improve lymphatic drainage, really.
Yeah.
And to do that, there are certain areas in the body, especially around the pelvis and the pectoral region, upper chest, and the diaphragm, that we can treat to reduce tension and hopefully allow the drainage system to function more efficiently. So that's where we're coming from a manual therapy perspective. And to supplement that, I'm a big believer in massage. I think massage can be very effective. And I think that's one of the benefits of the compression systems, such as Recovery System that you sell, is that it can replace sort of hands-on massage to some degree, because, well, firstly, it's easy to do. You can do it at home. You don't have to go out to a clinic, which is very relevant in present times.
Yeah.
And secondly, you can use it more. So you can have, if you like, the equivalent of a massage in the legs without having to go and see a therapist. So it can be a good adjunct, I think, to other types of intervention, along with movement and exercise, which I think is really important during the pregnancy, if it's safe to do so.
So for our listeners, let's just take a moment to describe what intermittent compression looks like. Essentially, it's squeezing from the foot to the thigh and moving the excess fluid up into the lymphatic area where the extraction takes place. So quite some relief from a swelling point of view. And as you quite rightly pointed out, it's a very convenient mode of treatment that can be done at home, and that can be done multiple times a day. So there's a little snapshot on pregnancy-related swelling conditions, the cause and the treatment. So thank you, Dr. Paul.